This is the fracture to be repaired in this exercise. The landmarks for the incision are the greater trochanter, the diaphysis of the femur, and the stifle. The foam is incised on the lateral aspect of the femur from the greater trochanter to the stifle to expose the proximal and distal bone segments. The fragments must not be disturbed. An intramedullary pin, that is approximately 30 to 50% of the diameter of the medullary canal, is inserted through the trochanteric fossa to the fracture site. The distal bone segment is lifted, and the pin is driven into the medullary canal. Holding the proximal segment with a bone-holding forceps, the pin is driven distally, distracting the fracture. A 12-hole 3.5 LC-DCP is contoured to an intact femur. The plate is secured by first placing a bicortical 3.5 mm screw through the most proximal plate hole, avoiding the pin. The rotational alignment is checked before placing the distal bicortical screw. The remaining plate holes over intact bone are filled with monocortical or bicortical screws, depending on the pin location. In the clinical case, cancellous bone autograft may be added to the fracture area. The pin length is checked, and the excess is cut.